Anxiety. Anxiety is a group of mental health conditions that cause fear and worry that are much stronger or last much longer than everyday stress. Everyone experiences anxiety at times, especially before important events or during difficult situations. The difference is that an anxiety disorder can make those feelings persistent and difficult to control, even when there is little or no immediate danger. Different types include generalized anxiety disorder, panic disorder, social anxiety disorder, and several specific phobias. Symptoms may include racing thoughts, a fast heartbeat, sweating, trouble sleeping, muscle tension, or avoiding situations that trigger fear. Researchers believe anxiety disorders develop through a combination of genetics, brain chemistry, personality, and life experiences. They are among the most common mental health conditions worldwide, but many people improve with treatments such as therapy, medication, stress management techniques, and healthy daily habits. If anxiety begins interfering with everyday life, seeking professional support can make a meaningful difference. Depression. Depression is much more than simply feeling sad after a difficult experience. It can create a lasting sense of emptiness, hopelessness, or a loss of interest in activities that once felt enjoyable. Many people also experience changes in sleep, appetite, energy, concentration, and motivation. Depression can affect people of any age and often develops through a combination of biological, psychological, and environmental factors rather than a single cause. It may appear after stressful life events, but it can also develop without any obvious trigger. Because depression affects each person differently, symptoms can range from mild to severe. With proper treatment, which may include therapy, medication, lifestyle changes, or a combination of these approaches, many people experience significant improvement. A proper diagnosis by a qualified healthcare professional is important because several different conditions can cause similar symptoms. Bipolar. Bipolar disorder is a mental health condition marked by significant changes in mood, energy, and activity levels. A person may experience episodes of depression along with periods of unusually elevated, energetic, or irritable mood, known as mania or hypomania. During manic episodes, someone may sleep very little, speak more quickly than usual, feel unusually confident, or make impulsive decisions they would not normally make. These episodes are much more intense than the everyday ups and downs everyone experiences. Bipolar disorder has several forms, including bipolar 1 and bipolar 2, which differ in the pattern and severity of mood episodes. Scientists believe genetics and changes in brain function both play important roles. Although bipolar disorder is a lifelong condition, many people manage it successfully through medication, therapy, education, and ongoing medical care. OCD. OCD, short for obsessive compulsive disorder, involves unwanted thoughts, images, or urges known as obsessions. These thoughts create intense anxiety or discomfort, leading a person to perform repeated actions or mental rituals called compulsions in an attempt to reduce those feelings. Common compulsions include repeated checking, cleaning, counting, arranging objects, or silently repeating words or phrases. While many people like things organized or clean, OCD is very different because the obsessions and compulsions become difficult to control and can consume hours of a person's day. Researchers believe OCD develops from a combination of genetic, neurological, and environmental factors. Effective treatments, including cognitive behavioral therapy and medication, help many people reduce symptoms and regain control over daily life. Post-traumatic stress disorder. Post-traumatic stress disorder can develop after someone experiences or witnesses a deeply frightening or traumatic event. While it is normal to feel distressed after trauma, PTSD involves symptoms that continue long after the event and significantly interfere with daily life. A person may experience nightmares, flashbacks, intrusive memories, emotional numbness, or become easily startled. Some people avoid places, people, or conversations that remind them of the trauma, while others struggle with feelings of guilt, fear, or anger. PTSD can affect military veterans, survivors of accidents, natural disasters, violence, or many other traumatic experiences. Not everyone exposed to trauma develops PTSD, and the reasons why are still being studied. Treatments such as trauma-focused therapy and medication have helped many people recover and improve their quality of life. Eating disorders. Eating disorders are serious mental health conditions that affect a person's relationship with food, eating habits, and body image. Common examples include anorexia nervosa, bulimia nervosa, and binge eating disorder, each with its own pattern of symptoms. These disorders are not simply about dieting or wanting to lose weight. Instead, they involve complex interactions between emotional health, brain function, genetics, and social influences. They can lead to serious physical health problems affecting the heart, digestive system, bones, and many other parts of the body if left untreated. Early recognition and professional treatment greatly improve the chances of recovery. Care often includes medical monitoring, nutritional support, therapy, and sometimes medication, depending on the individual's needs. Personality disorders. Personality disorders involve long-lasting patterns of thinking, feeling, and behaving that differ significantly from cultural expectations and can make daily life more challenging. These patterns usually begin by early adulthood and may affect relationships, work, emotional regulation, and decision-making. There are several different personality disorders, each with unique characteristics, so no two people experience them in exactly the same way. Researchers believe they develop through a combination of inherited traits, early life experiences, and environmental influences. Treatment often focuses on psychotherapy, which helps people understand their thoughts and behaviors while developing healthier coping skills. Progress may take time, but many people experience meaningful improvement with consistent care and support. Schizophrenia. Schizophrenia is a mental disorder that affects how a person thinks, feels, and experiences reality. Symptoms may include hallucinations, delusions, disorganized thinking, reduced emotional expression, and difficulty concentrating or organizing daily activities. These symptoms usually begin during the late teenage years or early adulthood, although the exact age varies from person to person. Schizophrenia is often misunderstood because of inaccurate portrayals in movies and television. In reality, most people living with schizophrenia are not violent, and many work, study, and build meaningful relationships while managing their condition. Scientists believe schizophrenia develops through a combination of genetic and environmental factors that affect brain development and function. Although there is currently no cure, treatments such as medication, therapy, rehabilitation programs, and strong social support help many people manage symptoms and improve their quality of life. Like all mental health conditions, schizophrenia should be diagnosed and treated by qualified healthcare professionals rather than through self-diagnosis.